Hello guys, this is Lily and welcome to my YouTube channel. In this video, I will be talking about a treatment plan for a condition, piriformis syndrome. So the definition of the piriformis syndrome, so it is the compression of the sciatic nerve by the piriformis muscle. So the sciatic nerve will be seen, or it is located on the from the lumbar vertebrae number 4 and 5. It will start from there, originates from there, and it will go down through the buttocks muscles and under the piriformis muscle. As you can see on the drawing that I have shown a while ago, that's where the under that piriformis muscle, that's the piriformis muscle, that's where the sciatic nerve will pass. It's gonna be under the piriformis muscle. So once the muscle is tight, okay, then the muscle will compress the sciatic nerve. That's where it causes pain or problem to the area. Okay. So this condition is often misdiagnosed as clinical low back pains. Okay, so associated with radiculopathy, pain radiating from the spine. That's what it means with radiculopathy. Okay, so secondary to lumbar spinal disc anomalies. Okay, so the onset is gradual if lifestyle related, sudden if trauma related. So here you go guys. So the onset is gradual if it's like lifestyle related. So just it's all about your lifestyle, your way of life. Okay, and it is sudden if it's caused by trauma. Okay, so trauma, like the area has been was exposed to like a no a force. Okay, force that can cause a problem on the area. Okay, use of force or something hard object, and the duration of this condition will be weeks or months. So you're gonna have pain and discomfort for weeks or months when you have this syndrome. Okay, so the risk is increased for skiers, so those who are doing the skiing. Okay, tennis players, long distance bikers, the truck drivers who sits down on driving on the truck for a long period of time, and taxi cab drivers as well, they're the same. Okay, so prevalence in women, so it is more common in women. Okay, so this piriformis syndrome. For the causes, so there is an anomaly, or there are anomalies in the course of the nerves, the sciatic nerves, such as penetration of the piriformis muscle. Like I said guys, if the piriformis muscle becomes tight, okay, that's when it compresses the sciatic nerve which runs under it. Okay, and often and yeah, so direct and indirect trauma, use of force to the piriformis muscle, okay, such as a fall on the buttocks, here you go guys, or a motor vehicular accident. Okay, that's a trauma. Okay, so it's gonna cause discomfort on the area. Okay, inflammation or degenerative changes, continuous changes of piriformis muscle, changes in that area. It's fascia or adjacent joints. So the fascia that surrounds the muscle, the area, and the adjacent, the nearby joints. Okay, there will be inflammation. Okay, there will be pain and discomfort. It will cause pain and discomfort. All right, so overuse, too much use of the piriformis muscle with repeated bending and lifting. Okay, here you go, guys. So repeated bending when you're doing that kind of movement, and lifting, okay, lifting any object. Forceful rotation or with the weight on one leg. Okay, so you don't do this, guys. Okay, so the postural and positional concerns. So you have to be mindful of your posture and position while doing tasks or movements. Okay, and anything that leads to or aggregates trigger points, which in turn cause shortening of the muscle, such as sitting on a wallet in a back pocket. Oh, right. So when you're sitting with your wallet in your back pocket, it's not good, guys. So here you go. So please be mindful of this. Okay, it will trigger piriformis muscle syndrome. Okay, pain and discomfort on your area, on that area. Okay. Additional will be additional costs will be like multiple causes, including compression, okay, irritation, if the area gets irritated, or injury to the proximal sciatic nerve. Proximal means top, pertaining to the top of the sciatic nerve by a spasming or contracting piriformis muscle. Okay, spasm, involuntary movement, or contracting, meaning the piriformis muscle is shortening or doing the movement. Hyperlordosis. So if you have your lower back has a condition, hyperlordosis, meaning the lower back is the extension of the lower. There's a severe curve. Okay, anatomic abnormalities, pertaining to any abnormalities on any on any tissue in the area, like muscle tissue or tendons on the area, and or extreme hypertonicity. Hypertonicity means tightness of the muscle. Okay, extreme of the piriformis muscle. So the extreme tightness of the piriformis muscle. Traumatic fibrosis. So pertaining to forceful, fibrosis means adhesion or tightness. Okay, on the area. Prolonged sitting, here you go. Vigorous activity that involves explosive bending or twisting. Here you go, guys. Okay, avoid those. For the symptoms, so there's pain in the buttocks. Okay, coccyx, the tailbone, the very end of your spinal column, the hip, the hip joint, the groin, or posterior thigh at the back of your upper leg. Okay, that's the most common symptoms. Okay, there will be numbness or tingling radiating down the posterior leg and or the lateral foot. So numbness and tingling, because it's a nerve, you're gonna feel this sensation, and it will go down to the back of your leg and the lateral, the side of your foot. Okay, so increased pain with extended periods of sitting, so more pain. Climbing stairs, so if you do sit down for long hours, and you're climbing stairs, or squatting. Okay, so you will feel increased pain. Now, spasm and or hypertonicity in the piriformis muscle. So we're talking about piriformis muscle. There will be involuntary involuntary movements, which is the spasm, and hypertonicity, like I said, it's like tightening of the muscle or shortening. Okay, so there will be weak hip abduction, meaning the movement of the hip abduction, meaning moving it towards the middle of your body. That's abduction. Sorry, my mistake. Abduction is moving your hip away from your midline of your body. You abduct, okay, towards the outside. Okay, that's if you're gonna have weak hip abduction. Okay, this movement. Now, a tender gluteal region. So your buttocks muscles, buttocks area, will be tender, meaning you have this painful sensation. Now there will be pain during bowel movements. Again, here you go, guys. So when you do your bowel movements, you're gonna feel pain as well. Okay, so hypomobility of the sacroiliac joint. Hypomobility meaning less movements. There will be less movement of the sacroiliac joints, which is the joint on the hip by the sacrum area. Okay, sacrum and the hip bone joining together, that would be sacroiliac joint. Now, a shortened stride length. Okay, so when you're walking, there will be it will be shortened, like short stride length on in your walking phase. Okay, so a shortened leg on the affected side. So if your affected side is the right side, you're gonna feel like there's a shortened, your right side leg is shortened than the left side, and vice versa. Okay, so a splayed foot, like noticeable lateral rotation. There will be you'll notice a lateral rotation, like your foot will be a little bit rotated to the side. Okay, on the side of your leg, like towards the side. When you lie supine, meaning when you lie down facing up. Okay, you're gonna notice a slight a lateral rotation. It's your foot is rotated towards your side. Okay, now let's move on to the part 2, which is the subjective component of the treatment plan. So here you're gonna find the health history question. So you're gonna ask your client all these questions to get to know about the condition, the piriformis syndrome. Okay, now you're gonna ask, is there a history of a systemic disorder, meaning involving in the system of the body, if there is any kind of disorder or problem, such as diabetes, okay, rheumatoid arthritis, inflammation of the joints, of any joint, okay, or hypothyroidism, meaning hypothyroidism is a problem of the thyroid where you have low or reduced metabolism. Okay, and is the client pregnant? Okay, you have to ask this question as well. Okay, next, has the client seen a physician for a diagnosis? So it's very important to ask this question to know if the client have seen his or her family doctor. Okay, so what tests were performed to determine the diagnosis? So you're gonna ask the client when the client sees the family physician, if there were tests done to diagnose the problem. Now next, what parallel therapies, if any, has the client had, such as physiotherapy or chiropractic therapy? Physiotherapy, you're gonna go to see a physiotherapist, and chiropractic for a chiropractor doctor. Okay, this involves like bone treatment. Now, is the client taking any medication? It's very important as well. Like always, you have to ask the client if he or she is taking any medication, or have cortisone injections been given? So particular medication that you can ask about this problem. Has an injection been received in the last 10 days? If there's injection for any medication in the last 10 days, very important, guys. How long has the client been experiencing discomfort? So you're gonna ask for the how long the discomfort has been experienced by the client. So with this question, you're gonna determine if this condition is acute or if the condition has been chronic already. Next question you're gonna ask your client is, what is the sensation? So you're gonna ask the client of the sensation that the client is feeling, right? For the pain and discomfort, if there's like numbness, tingling sensation, and in a scale of the pain, for the pain scale, in a scale of 1 to 10, you're gonna ask the client what is his or her pain scale. Okay, 1 being the less pain and 10 being the worst pain. Okay, so you're gonna ask whatever sensation that the client is having for this with this condition, the piriformis syndrome. Okay, next, where does the client feel pain or altered sensation? So you're gonna ask where, in which location does the client feel pain. Okay, if there is any other sensation like numbness, tingling, like I mentioned a while ago, or any kind of sensation. What is the quality of the pain? Okay, like I mentioned, quality of the pain, if it's throbbing, dull, achy sensation, pain, shooting, pain. You're gonna ask the client, how intense is the pain or sensation? How intense? Like the scale, like I mentioned a while ago, scale, okay, of 1 to 10. Now, how frequent is the pain or discomfort? So how frequent? If is it every hour, every day, once a week, or once a month? So that's, you're gonna ask how frequent is the pain or discomfort with your client. What are the client's postural habits, okay, including occupational, recreational, and sleeping? So the posture of client when the client is working, if the client is sitting a lot or standing a lot, during recreational, you're during sports related activities, and this sleeping posture of the client. Okay, how the client sleeps. Okay, how the client sleeps during the night. It's very important to know. Are there any positions or activities that aggravate the symptoms? So you're gonna ask the client of this. So is the client doing any activities, or is the client position aggravates or increases the symptoms of pain or any discomfort? Okay, so what relieves the symptoms? So you're gonna ask the client what the client do to reduce the symptoms of this condition. Okay, you're gonna ask this question with the client. Okay, is there a history of injury to the hip, sacrum, or low back? So it's very important if there's a history of injury to the hip area, to the sacrum, where the tailbone is, and to the lower back. Okay, so here you go, guys. These are the questions that can help you in your assessment or in the treatment plan for this condition. Now let's move on to the part 3 of the treatment plan, which is the objective component. And in this level, we're gonna do the assessment. Okay, for the assessment, a massage therapist will not assess for the presence of piriformis syndrome, but instead will treat the secondary symptoms which will have been diagnosed by a physician. Okay, so take note of this, guys. So for the observation, so you're gonna do all this information here. Just take a look at this, guys. It's very important. You're gonna do some palpation as well. So just take a look at this information, guys. Okay. For testing, you're gonna do active free and passive resisted range of motion of the hip that will reveal decreased internal rotation accompanied by pain on the affected side. Okay, so the active resisted strength testing of piriformis is positive for weakness and pain on the affected side. So these are the testing that you're gonna be looking for in assessing this condition. Now for the special test, we have here the PACE abduction test. And with this test, it should be positive. If you do this test, it will be a positive for the presence of this condition. Now, the piriformis length test is positive as well for a short piriformis on the affected side. Okay, so another test to do is piriformis length test. Okay, it will help you assess for this presence of this problem, the condition. Now, the sacroiliac joint motion palpation may reveal restricted movement on the affected side. So you're gonna do palpation on somewhere on the area where the sacroiliac joint is, okay, in the middle, on the hip area, from the lower back area on the middle side towards your tailbone. So that area, the sacroiliac joint. So you're gonna palpate to look for restricted movements and pain or discomfort. Okay. Now for the contraindications or precautions, so when treating a client with presenting this condition, piriformis syndrome, you're gonna be careful. So do not massage local for 10 days after a cortisone injection. Take note of this, guys. Avoid compression of the sciatic nerve when massaging the buttocks. So you have to know where the location of the sciatic nerve and where it passes in treating this condition. Okay, it's very important. This precaution is especially of concern when using the elbow at the lateral border of the sacrum. On the side of border of the sacrum, you should be cautious with using your elbow in doing the technique. Okay, if the client experiences numbness and tingling down the leg to the foot, this could indicate compression of the nerve and the technique is stopped. There you go, guys. Be careful. Do not perform frictions if the client is on anti-inflammatories. So if the client has been taking anti-inflammatories or is on anti-inflammatory medication during the treatment, that's why it's very important on the questions, asking questions to know if the client has been taking medication. Please do not perform any friction. Okay, here you go. And joint play. Okay, joint play means moving the joint in the hip joint or the joints, the sacroiliac joint along the hip and sacral mobilization. So the sacrum mobilization, the sacrum joint movements are avoided in the third trimester of pregnancy. Here you go, guys. And performed with extreme caution with osteoarthritis, so inflammation of the bone and the joints. Okay, or with a degenerative condition, meaning a condition that is continues to degenerate, continues to become worse, little by little. Okay, it's not stopping. That's what it meant. That's what it meant. Okay, degenerative condition affecting the hip or sacrum. Okay, so you have to be mindful if there's other condition, especially degenerative condition in the area affecting the hip or sacral area. Okay. Okay, the part 4 of the treatment plan. Part 4. Now it will be dealing with goals of the treatment. Now, so there we have lots of goals listed here. Just take a look at this, guys, okay? For the positioning, pillowing, and draping as well, we have a list here, so just take a look at this, guys. Now, for the general treatment of this condition, the piriformis syndrome, so if hyperlordosis is a contributing factor, hyperlordosis is a abnormality in the lower back, so more curve on the lower back. The treatment is started with the client supine. Okay, supine means facing up, so the client back is on the table, face up. If hyperlordosis is not a concern, okay, if the lower back is normal, the curve, the treatment is started in the prone or side-lying position. Prone meaning face down, so on the abdomen is on the table, face down. Side-lying, side on the side. Okay, position. Now, side-lying position is used if the client is in the 3rd trimester of pregnancy. So we're talking about pregnancy here. So you're gonna position the client on the client's side. Okay, the lower back is massaged using effleurage and patrissage, as well as mobilization techniques to the lumbar spine. Okay, so lumbar spine, it's the lower back area. Okay, so you're gonna use these techniques, effleurage, patrissage, and some mobilization techniques. Okay, the quadratus lumborum, we commonly call it QL. It's located on the lumbar vertebrae area, the lower back. Is treated thoroughly for hypertonicity, meaning for tightness of this muscle, and trigger points like tender points, like there will always be pain in this area, especially if hyperlordosis is present. So if this hyperlordosis, excessive curve on the lower back is present, then you're gonna be treating the quadratus lumborum muscle, which is present on the lower back area. It attaches to the lumbar vertebrae and the hip, the iliac crest, the hip bone. Then you're gonna treat the area for its tightness thoroughly. Okay. Now, if there's pes planus, okay, low arch, if it is a contributing factor, okay, specific treatment of this condition is incorporated. So you're gonna take note of this as well. The therapist addresses the hypertonic iliopsoas. Hypertonic means tight iliopsoas, the group of muscles that is located on the lumbar area, the lower back area. The lower back area, and it attaches to the hip, the leg, the upper leg bone, okay, towards the greater trochanter. Okay, so where the hip joint is, okay, and rectus femoris, before turning the client prone. Okay, so rectus femoris muscle is the muscle in the hamstring group. It's located on the back or the posterior area of your upper leg. Okay, so joint play, movement technique to move the joint is used on a hypomobile sacroiliac joint. So hypomobile, like a little bit immovable. Like it's not really movable sacroiliac joint. So the sacral area and the hip bone fused together, the sacroiliac joint. Okay. So for the specific treatment of this condition, just read on this information, guys. More information. Now, for the techniques to be used for this condition during the treatment, so just I have a few here listed. So just read on this, guys. Take a look at this. Okay, so for the hydrotherapy, the treatment using warm or cold water. So it will include deep moist heat over the affected buttocks or affected buttock while massaging the lumbar region. So you're gonna put a warm hydrotherapy application on the buttocks, the affected buttocks or the affected buttock muscle, and while you massage the lower back area, okay, the lumbar region. Now, if there's edema or swelling present, if it's present, you have to use cool towel wraps, okay, and over the affected area. So if there's swelling or edema, you're gonna use cool towel. You wrap it on the affected area. Okay, for contrast applications, it can be used post treatment to improve circulation. Post after the treatment to improve circulation, like to increase blood circulation or lymph circulation, and flush metabolites. Okay, so flush away abnormal products, metabolites in the body, okay, in the area. All right, so now for this part 5, which is the self-care plan, the goals for this will include to stretch tight short muscles. Okay, so you're gonna do stretching on these muscles to reduce tightness, to strengthen weak muscles. So the weak muscles, you're gonna do strengthening exercises or massage to strengthen these weak muscles. So for massages, you're gonna do brisk techniques on the weak muscles, and you have to educate your client about the don'ts, the pros and cons, or about what the client needs to know about to know and to do about the condition. And you're gonna refer the client if there's a need for you to refer the client to other practitioners like physiotherapists, chiropractor. Now you're gonna encourage relaxation with the for the client. So it's very important. You're gonna ask the client to relax, okay, especially the affected area. Now we're gonna move on to remedial exercises. So remedial exercise is an essential component to treating piriformis syndrome. Okay, remedial exercises. You're gonna teach the client to reduce the symptoms or to help the client with this piriformis syndrome condition. Okay, if a client can perform a self stretch for the piriformis muscle using a belt or rope, okay, The client lies supine on the floor with the rope looped around the foot of the affected site, and the ends of the rope are held in the opposite hand. On the side to be stretched, the knee is extended and the hip is flexed to approximately 90 degrees. The hips are kept stable on the floor while the leg is drawn away from the side to be stretched towards the opposite hip. The stretch is held for 30 seconds. The leg is then drawn further towards the opposite hip, placing an additional stretch on the piriformis muscle. So there are other exercises that you can find. Just research on that. That could be a remedial exercise that you can give to your client with this problem. Okay. Okay, so additional information, additional remedial exercises. Just read on this, guys. Take a look at this. Okay, the part 6, which is the treatment frequency and the expected outcomes. So for the treatment frequency, how often you're going to treat your client with this problem. So a 1-hour treatment allows a thorough treatment of the lower body. So 1-hour treatment for the lower body. The treatment focus is alternate between the piriformis syndrome and aspects of a contributing condition such as hyperlordosis or pes planus. Pes planus is, low arch on the plantar area. Okay, so an hour treatment. Now, initially, treatments are more frequent, ideally twice a week for a few weeks. So twice a week for a few weeks, guys. Just assess your client, okay, in the frequency of the treatment. Now, otherwise, once a week for 4 to 6 weeks is recommended. Okay, so you can do this as well, followed by a thorough reassessment. Like I said, you should reassess your client's response to the treatment that you have done. Okay, if pregnancy is the cause, the condition will often resolve postpartum. Okay, so after giving birth. Now, only temporary relief is possible if a systemic pathology is present. Systemic, like, in the body system, there's a abnormality or pathology, is present. Now, for the expected outcomes, if the cause involves soft tissue like muscle, tendons, ligaments, the prognosis is good. Okay, providing the client is compliant with the self-care program. Okay, so it's saying that the client should be compliant of his or her self-care program. So the self-care program that you're gonna give to your client, okay? Make sure the client should be compliant, should comply on this. All right. So here you go, guys. This ends our treatment for the condition piriformis syndrome. Thank you for watching my YouTube channel, and please subscribe, like, comment, share on this video. Thank you again, and you have a great day.